Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Inshallah, we will continue on our viral hepatitis. And in the last lecture, we discussed hepatitis A and hepatitis E. And we said that both hepatitis can be transmitted orofically or through oral cavity. Now we will discuss, inshallah, hepatitis B virus, and most important one, and the transmission will be through the serum or through the blood. Before, they said that hepatitis A and hepatitis E is known as infectious hepatitis. Hepatitis A, known as infectious hepatitis, because the transmission is through infection or contaminated water and food. And hepatitis B, known as serum hepatitis, because the transmission is through the blood. This is before, because only two types of hepatitis known before, hepatitis A and hepatitis. Now there is hepatitis A and hepatitis E can be transmitted through the contaminated food and water, and the other hepatitis can be transmitted through the blood and body fluid. And they said this is that one, hepatitis A and hepatitis E is infectious, and this is blood or serum hepatitis. Let us see this structure of hepatitis B virus. Hepatitis B is discovered by Dan. He discovered this hepatitis B. And if you see this structure, you will find from our side, there is envelope, and through this envelope you can find this hepatitis B surface antigen. One is large surface protein, hepatitis B surface antigen, and one is medium surface protein, and the third one is a small surface protein. All this hepatitis B surface antigen. You can find, this is outside, this is envelope. Inside, you can find the capsid, and this is the core. Inside this core, you can find DNA. This is DNA and DNA polymerase. This is enzyme. DNA and DNA polymerase inside the core or inside the capsid. Outside, you can find hepatitis B E antigen. This hepatitis E antigen from envelope or from external, it will you can find it between the surface, hepatitis B surface between the envelope and the capsid. This is hepatitis B E antigen. This is very important antigens, hepatitis B E and hepatitis core antigen and hepatitis B surface antigen. So we'll discuss this later, inshallah. This is a most important marker of hepatitis. Hepatitis B, as we know, it is belong to family of Hepatnavirus, Hepatnaviridae, and it is DNA virus. So all the viral hepatitis are RNA virus, except hepatitis B virus is DNA virus. This is the most important thing from the start. All viral hepatitis is RNA, except hepatitis B is DNA virus. So, because there is envelope, as we see in the structure, there is envelope. The virus, hepatitis B, contain envelope. Unlike that one, hepatitis A. Is there is any possibility of transmission through oral or fecal? No. You can find the virus in the blood, in body fluid, all the type of body fluid you can find the virus in. So why cannot be transmitted through the oral cavity? As we said before, in hepatitis A virus and hepatitis E virus is an envelope virus. This envelope virus cannot be transmitted orally because if envelope virus gets it through the GIT, so there is enzymes and acidity in the stomach and in the GIT. so it can be inactivating the envelope. If the envelope be inactivated, so the virus will be inactive, so it will not be transmitted. So the unenveloped virus can be transmitted through oral cavity, but the enveloped virus will not, there is no any possibility to transmit it through the oral cavity. This is the rule. You should know this. So through this mode of transmission, so it can be transmitted prenatal transmission. So there is perinatal transmission, or percutaneous, we call that, through contaminated body fluid, especially blood, or blood transfusion and organ transplantation, or through needle stick injury, like tattooing, piercing, exposure to infected blood and body fluid, such as saliva, menstrual, vaginal discharge, seminal fluid, and sexual. So we can say the mode of transmission, we can say through three ways. The first one, through the blood and percutaneous transmission. Blood and percutaneous transmission. And this is either through blood transfusion or by piercing by sharp. If the skin pierced by any sharp contaminated by blood or by body fluid, it can be. So the risk group of this people, or we can say drug addicts, and blood transfusion patient receive blood, always anemic patient like sickle cell anemia, sickler or other anemia, you need transfusion always, and renal dialysis, that patient with renal impairment and they need dialysis. All these people are risk for blood hepatitis B virus. This is the one. So the first one, through blood or percutaneous transmission. Percutaneous, through the skin, either through the intact skin by piercing by the sharp. خلاص، يعني انه يكون السكين intact سليم وبطعنه ابره او بموس او باي آلة حاده، يعني intact skin through piercing, or maybe through intact skin، يعني لو كان through wound، لو there is wound or injury or any intact skin, and if there is any body fluid or blood come through this wound or through opening the skin, it can lead to infection. This is the first one, through blood and percutaneous transmission. The second one, perinatal, and this is perinatal. There is difference between perinatal and prenatal. Anybody knows about this, perinatal and prenatal? What is the difference between these two words?
Perinatal transplacental. Prenatal transplacental, I think.
Prenatal. Or
yeah.
perinatal.
Perinatals during labor.
Peri or pre? Which one? Through placenta?
Pre.
Pre means before. Pre means before.
Yes.
So pre can be transmitted through placenta. But peri, this is mean during or after. Peri, during or after, immediately after. So perinatal, from mother to child, during birth, or after birth, during lactation. Yani the mother can transmit the child through or during the birth, or during lactation, through the body fluid, because we said that the body fluid contains virus. So it can be transmitted through the milk, or it can be transmitted through the vaginal discharge or the fluid during the birth. It can be. This is perinatal, but unlikely to be transmitted through prenatal. So through placenta, the hepatitis B, till now, no study said that it can be transmitted through placenta. Hepatitis B, it can be transmitted after birth, during birth, and after birth. If you ask me, you said before, hepatitis A and hepatitis E can be transmitted orally. And this hepatitis B, it can be transmitted through lactation, through the milk. How? If the virus is enveloped virus. And this enveloped virus are likely to be transmitted through the GIT because there is enzyme and acidity. And this envelope is very weak. It can be inactivated by this fluid, by this enzymes and by this acidity. How can this lactation or milk from mother can be transmit this to the child through the lactation? Anybody knows? So we can say this can be transmitted not through oral cavity. It can be through oral cavity, but it is not orally. It will not go through the GIT. It can be transmitted through mucous membrane of the oral cavity itself. If the mucous membrane of the oral cavity is intact, if there's any problem, if there is any ulcer, abrasion in the mucous membrane, in the skin of the oral cavity, during the lactation, the baby can receive this milk and the virus can enter through this piercing, through this abrasion, or through the ulcer. So the transmission, it will be through mucous membrane, intact mucous membrane, not through the GIT. Because if the virus enters through the milk to the stomach or to the GIT, it will inactivate the envelope. The third way that it can be transmitted through is sexually. And sexual transmission, either because, as we said, the fluid, it contains virus, semen, and vaginal discharge. So it can be transmitted sexually. The virus can survive outside the body for at least 7 days. At least 7 days. So if there is any contaminated syringe or any sharp or any containers, there is blood outside and you have a problem in your skin, abrasion or ulcer, or if you have a wound, maybe this it will be contaminated for at least 7 days. So the hepatitis B, the transmission is mainly through blood and body fluid. For this, we can say transmission of hepatitis B virus have 3 B's. Blood, through blood, baby making, during birth, birthing, either through sexually or birthing during perinatal, during birthing. This is the 3P virus, blood, baby, and birthing. If we see here the concentration of hepatitis B virus in various body fluid, so for blood, we will find blood and the serum and wound exudates, they have high concentration or high load, viral load. These 3, blood, serum, and wound exudate. Moderate one is semen, vaginal fluid, saliva. The low or not detected through urine, feces, sweat, and tears, breast milk. This is very low or it might not be detectable through this fluid. So the transmission through breast milk is very low. Why? Because first, it needs mucus intact mucous membrane of the baby during birth. This is the first one. The second one, the virus is very low in this fluid. You will not find a virus. Or if you find, it is very low concentration in this body fluid. For clinical findings, before we discuss this clinical findings, let us see first there is antigen and antibodies, how this manifestation appear or occur during the period of the illness. The first thing, the incubation period, it unlike the hepatitis A, it needs 90 days. The incubation period, 90 days, 2 to 6 months. Hepatitis A, it needs 2 weeks to 6 weeks. So the incubation period is very long in hepatitis A. And to understand this symptom and sign very well, there is antigen and antibodies. And also we discussed this in the last lecture, that the antigen from the virus and antibodies produced by the body or by the immunity, it leads to cytopathic effect. So the problem in the liver failure and liver dysfunction, it will occur due to the body immunity, not due to the virus itself. So the virus hepatitis, all hepatitis, all virus hepatitis, or all hepatitis virus is not hepatocidal or hepatopathic or cytopathic. It is only affect releasing the immunity of the body, and the immunity, it can lead to damage of the liver cell. If you know this zone of phenomenon, there is antibodies and antigen. If the antibody, when the antigen and antibody are available in equivalent amount, so the antigen will combine to the antibody, and this is will lead to antibody antigen complex. And this complex, it will be large because most or all the antibody combine to antigen and make a very big immune complex. This immune complex, it will be visible by body immunity. It can be visible or detectable by laboratory. So when this both antigen and antibody available in equivalent amount, so large immune complex will be detected, and it can be visible for the immunity of the body. If it can be visible, so it can be the macrophage can ingest this very large immune complex. If the antigen or antibody is small in a small amount, for example, if the antibody in a small amount and antigen is in large amount, so there is some antibody will be free, and vice versa. Also, if the antigen is very large and antibody is small, there is some antigen, it will be free. In this, the immune system will be very small and cannot be detected in the lab, and cannot be detected in the lab, and cannot be detected by immunity of the body. By this way, so this complex can go through the blood, and it can affect the other side of the body. Not only the symptom and sign, it will be only in the liver dysfunction or liver damage. So it can be deposited in for example, in joints. It can lead to joint pain, in abdomen. It can lead to some symptom and sign of abdominal discomfort. It can lead to liver dysfunction. It can cause, this is an ecteric phase, it can lead to dark urine or clay colored stool. The clinical feature, we can divide it into 3 prodromal symptoms, and ecteric and conventional. In prodromal symptoms, we can find you can find releasing of interleukin and tumor necrotic factor, and this may lead to flu-like symptom. This viremia in the blood, may release interleukin and tumor necrotic factor. This may lead to flu-like symptoms, fever, headache, and fatigue. And sometimes anorexia, nausea, joint pain, muscle pain, and skin. The other one is ecteric phase, and this ecteric phase due to liver damage, and this leads to jaundice, either conjugated or unconjugated jaundice. If the damage in the liver, it will be unconjugated. If it is in bile duct damage, it will lead to conjugated jaundice. The third one is convalescent phase. In convalescent phase, and this is recovery for that. Let's complete this. For this dark urine and pale stool, most probably due to the jaundice itself, and also hepatomegaly will find enzymes. The liver enzymes will be high, very high, mainly ALT and AST. The third one is convalescent. The convalescent phase, recovery phase, symptoms become mild and gradually improve. So the liver size return to normal, appetite improve, jaundice decreases, stool and urine return to normal color. This is the third one. So you can find all these symptoms or all these three clinical pictures in hepatitis A and E and also hepatitis B and C, but the difference only for in incubation period and severity and chronicity. So the severity and chronicity is less in hepatitis A and hepatitis E, and it is more in hepatitis B and hepatitis C. So the outcome here, acute hepatitis B, 90% resolution. 90% of cases, they will recover completely, and only 9% hepatitis B surface antigen may persist to till 6 months, and this may lead to chronic phase. Only 1% fulminant hepatitis may occur. So in hepatitis B, less than 1%, they may lead to fatal fulminant hepatitis. 90% resolution. In this 9%, you can find 50% resolution from this hepatitis B surface antigen. If persists till after 6 months, you will find 50% resolution. Asymptomatic, this is carrier, chronic persistent hepatitis, chronic active hepatitis. And this chronic active hepatitis, it can be chronic active hepatitis and chronic persistent hepatitis. You can find it outside the liver, extrahepatic disease like polyarthritis, nodosum, and glomerulonephritis. Also, it can lead to cirrhosis, and this cirrhosis and chronic active hepatitis, both of them, they can lead to hepatic cell carcinoma or hepatocell carcinoma. The pathogenesis after the virus enters the blood, as we said before, the virus infects hepatocytes and the viral antigens are disappeared. And the cytotoxic T cells mediate an immune attack against the viral antigen. And inflammation, necrosis will occur. And the pathogenesis of hepatitis B is probably the result of this cell-mediated immune. So the injury, because hepatitis B itself does not cause, or it is not a pathogenic or cytopathic or cytopathic effects, it has no cytopathic effects. So that this damage of the liver, it comes from antigen antibody complex and from the immunity itself. When this antigen antibody complex compound and they form this large amount of complex, it may lead to extra hepatic symptom and sign like arthralgia, arthritis, and urticaria. And some of these complications in chronic hepatitis, this may lead to glomerulonephritis. So here you can see acute hepatitis B infection 95% of this hepatitis can affect infant. If 95% of this infant infected by hepatitis B because they have low immunity, so symptom and sign may be not be in the patient, in a child or infant, but the replication of the virus will continue without any symptom and sign because no immunity will be developed against this viral replication. So the chronicity may increase during this infant infected during the childhood. And if the infection occurs in a child, most probably they will develop to be chronic. But for adults, most of the adults may be recovered without any complication or without chronicity. Laboratory diagnosis of hepatitis B, detection of hepatitis B surface antigen by ELISA. Before we discuss hepatitis A virus detection or diagnosis through the increasing the enzyme and through the ELISA, it can be, we can do PCR also, but we said it is not used for detection the virus in a patient, just for study. Here we can detect hepatitis B surface antigen through ELISA. Before we discuss this, we have hepatitis B markers. We should know these markers because it is very important to understand the diagnosis. The most important and most complicated when is the diagnosis of hepatitis B virus, not like hepatitis E or hepatitis A. So we should know first these three types of antigen known as hepatitis B marker. We have hepatitis B surface antigen and hepatitis B clone or hepatitis B core antigen, as we saw that before in the structure of hepatitis B virus, and hepatitis E antigen. These three antigens, hepatitis B surface antigen, hepatitis B core or C antigen, and hepatitis B E antigen. If the virus enters the body, will form antibodies against these antigens. So anti-hepatitis B surface antibody will develop after entering of the virus through a hepatitis B surface antigen. And also anti-hepatitis B clone will detect it. And anti-hepatitis B E antigen, anti-hepatitis B antigen will also detect it. When hepatitis B surface antigen disappears, the hepatitis B surface antibody will be detected. And we can see this in this diagram. If you see here, hepatitis B antigens. We have here incubation period, infectious period, and immune. And we have hepatitis B surface antigen. This is the first one, hepatitis B surface antigen. This is orange. I think orange, if clear for you, orange color. This is the line. Hepatitis B surface antigen will appear in the incubation period, and it will be disappear in the end of the infectious period, and at 6 months, before 6 months, it should be disappear. If this hepatitis B surface antigen disappear, so hepatitis B surface antibody, this one with line with here, as you see, this may be blue, maybe blue. This hepatitis B, anti-hepatitis B surface antibody, anti-hepatitis B surface will appear, not will appear, will not say appear, will be detected, because maybe this is appear before this period. So when hepatitis B surface antigen disappear, the hepatitis B surface antibody will be detected. So the good phrase when we said it becomes detectable after disappearance of hepatitis B surface antigen. And we say hepatitis B surface antibody is neutralized the antigen. يعني when you find this hepatitis B antibody, يعني انت لو لقيت hepatitis B لقيت anti hepatitis B surface معناه هو هيشتغل ضد منه الهيباتيتس بي سيرفيس انتيجين. ده انتيبودي بيشتغل ضد الانتيجين. خلاص. If you find this antigen antibody معناه if the antibody appear the antibody will disappear. And this is known as neutralized antibody neutralization. يكون حصل neutralization ما بين الانتيبودي and antigen. الانتي بودي جاء وغطى على الانتيجين هيكون عمل نيوتراليزيشن بالاميونيتي. طيب بالنسبه للهيباتيتس اي انتي بودي هنا هيباتيتس اي انتي بودي cannot be considered as neutralized antibody. هنا في هيباتيتس اي انتي بودي it appear and disappear at the same time in infectious period. See it by this green line. It will appear during infectious and disappear at the same time during this infectious. And after this hepatitis B antigen, you can find anti-hepatitis B antibody appear. Anti-hepatitis B will appear. But the difference between this hepatitis B and hepatitis B surface and hepatitis B, the hepatitis B it is not neutralized, so it is not immunity. يعني the appearance of this it will not lead the patient to be immunized by this E, but by hepatitis B surface antigen. Yes. So we can say hepatitis B surface antigen will appear at the incubation period along through the acute phase of the disease till 6 months from infection. If it continue after the 6 months, so it will be chronic. Will be chronic. And hepatitis B surface antibody start to be detected when hepatitis B surface antigen disappear. If it is present, that means the immunity appear because it is a neutralized antibody. Is it clear? Because if this is the most important area, this is the markers for the diagnosis and for laboratory diagnosis and clinical diagnosis. If you know this well, so you will understand hepatitis B very well. Is it clear? So for hepatitis, this is for hepatitis B surface antigen. And let us see the hepatitis B clone or hepatitis B core antigen. The hepatitis B core antigen, nobody will see this. Not clear. Why? Because hepatitis B core antigen cannot be detectable in the serum. You cannot detect the hepatitis B core antigen through the blood or from the serum. Why? Because this the core inside the liver cell, so it cannot be detectable. Only you can find it through biopsy. If you do biopsy through liver side, you take a liver and do biopsy, you can extract this antigen core through this biopsy. But from the blood, you will not find hepatitis B core antigen. So we can say hepatitis B, only you can find hepatitis B core antibody. And this hepatitis, anti-hepatitis core, you can find total anti-hepatitis core. And this anti-hepatitis core, you can find anti-hepatitis core IgM and anti-hepatitis core IgG, or the total. And this hepatitis B core antibody, IgM, means that this is a recent infection. Means that there is recent infection. يعني في حاجة اسمها window period. I think all you know about this window period. Window period. And this distance between hepatitis B surface antigen disappear. خلاص. Hepatitis B surface antigen disappearing and hepatitis B surface antibody undetected. You find neither hepatitis B surface antigen nor hepatitis B surface antibody. يعني في وقت في الويندو بيريود دي ويندو بيريود يعني بتكون الوقت اللي بيحصل فيه disappearing للهيباتيتس بي سيرفيس انتيجين ما في. وقبل ما يظهر الانتي بودي خلاص بتبدا تختفي الانتيجين، وقبل ما يزيد الانتي بودي عشان يظهر يبقى ديتكتد، يكون في الفتره دي الاثنين ما في. يعني انت في البلد ما حتلقى لا هيباتيتس بي سيرفيس انتيجين ولا حتلقى هيباتيتس بي سيرفيس انتي بودي. دي اسمها الويندو بيريود. خلاص يعني هنا ما حتقدر تعرف انه البيشنت هو عنده ولا ما عنده في الفتره دي بالتحديد. ما قلنا الويندو بيريود دي الوقت الوحيد اللي ما بيكون فيه هيباتيتس بي سيرفيس انتيجين disappear and hepatitis B surface antibody not detected or not detectable. So how can we know this patient have hepatitis? This patient has hepatitis B at this period. How can we know this patient has hepatitis B or no at this period? So the only marker can resolve this problem is hepatitis B core antibody IgM. وحيد اللي بيظهر في الفترة دي معمول باللون البلو، لون لبني بلو فاتح، انتي هيباتيتس بي كور IgM. شايف بيبدا من الانفكشوس بيريود وبينتهي قبل نهايه ممكن ل 6 بعد 6 مانثs. الفتره ما بين الاميون وما بين الانفكشوس بيظهر الانتي هيباتيتس بي كور انتي بودي. ده الوحيد اللي ممكن يعمل لي ديتكشن للانفكشن في الويندو بيريود. طيب for hepatitis E, for hepatitis B E antigen, do you see this hepatitis B E antigen? Hepatitis B E antigen by the green color. As we said before, this is green color. Green color. And if you find hepatitis B E antigen, that means this is an acute phase. This is an acute phase. So it rising after during infectious period and disappear or undetectable at the same period. So if you find it in the circulation, if you find hepatitis B E antigen in the circulation or in the blood, that means this a full virus. This is a full virus. This is not an empty envelope. Sometimes you can find empty envelope, and you can find this in hepatitis B surface antigen. Sometimes you find hepatitis B surface antigen, but without DNA of the virus. And just you can find just antigen. Here, if you find hepatitis E, that means this is a full virus, not an empty envelope. And this is indicators of infectivity. يعني whenever you find hepatitis B E antigen, that means this patient is in infectious period. يعني هو الفترة اللي بيكون فيها معدي. ليش؟ لأنه معظم الفيروس الآن هي بتطلع ثrough the blood. في فيروس بيحصل له replication معناه في فيروس بيطلع through the serum. معناه في الفترة دي هو حيكون the most infectious in this period. If this hepatitis B E antigen disappear, that means this is a good prognosis, this is a good sign that the patient will not be chronic. معناه خلاص إن البيشنت بدأ يحصل له recovery. خلاص بدأ يتعافى. بعد تبدأ تختفي هيباتيتس بي إي أنتيجين وتبدأ تظهر له هيباتيتس بي الإي أنتيبوديز. معناها المريض بدأ يتعافى وما حيحصل لي ما حيمشي لكرونيك. This is good prognosis sign and at the same time إنه البيشنت خلاص ما حيكون infectious. الانفكتيفيتي بدأت تحصل لها شيء disappear. We come here and say again. So detection of hepatitis B surface antigen by ELISA. Hepatitis B surface antigen is detected during the incubation period and prodromal period, but during convalescence is replaced by the appearance of hepatitis B surface antibody. The persistence of hepatitis B surface antigen more than 6 months indicates chronic infection. Window period is the period when hepatitis B surface antigen has disappeared from blood, but hepatitis B surface antibody is not yet detectable. Infection during the window period is detected using hepatitis B core antibody, not antigen, because antigen it will not be detectable at all. Why? Because it is inside the core, it is inside the cell, the liver cell, so it can only be detected through biopsy. Hepatitis B core antibody is present in those with acute infections and chronic infections, and in a patient who have recovered. And hepatitis B core antibody present in acute infection or in chronic infection. So it's not a diagnostic. In acute, you can find it in acute, and you can find it in chronic infection, and in a patients who have recovered. To distinguish between acute and chronic infection by using IgM core antibody and IgG core antibody. So if you find period and sometimes during chronic cases, and this indicates a high likelihood of transmissibility of infection. This hepatitis B E antigen rises during incubation period and prodromal period, and sometimes during chronic cases. And this indicates that likelihood of transmissibility, or the patient is in infectivity, or the patient is infectious. And it indicates a high likelihood of transmissibility of infection. Hepatitis B E antibody indicates lower likelihood of transmission. يعني لو ظهر الانتيبودي خلاص البيشنت ده بقى ما معدي. يعني الناس اللي بيكون عندهم ولا لهم نصائح انه يمكن كان بي ترانسميتد سكشوالي مثلا هاسباند بالنسبه للوايف، عشان انه اللحظه الوقت اللي ممكن يكون فيه not infectious or there is no infectivity، لما يظهر يعملوا تحليل ويظهر الهيباتيتس بي انتيبودي، معناه خلاص بعد ده ما بيكون في قابليه انه يحصل عدوى بالنسبه للاعضاء. يعني هنا بيكون ما في مشكله. او لو حتى مثلا حد عنده ويعرف انه مثلا there is patient with hepatitis non case of hepatitis B، ويحصل له مثلا يطعنه مثلا بإبرة خلاص او بحقنه، ويجي يشيله وينطعن بها او بالخطا حصل له ومش عمل تحليل لقوا الهيباتيتس بي اي انتيبودي ديتكتد. خلاص اذا الهيباتيتس بي انتيبودي ديتكتد معناها قابليه انه يحصل لك انفكشن، خلاص دي بقت ما في، ودي حاجه كويسه انه لانها ما في الانفكتيفيتي فيس، ما في الانفكتيفيتي فيس. Also, it can be detected by or through PCR, but always the PCR not used for diagnosis because it is very expensive and sometimes you will not find it in all laboratories. So difficult. But there is some lab or some countries they can use this PCR to confirm the infection with hepatitis B. And if you find it through ELISA, hepatitis B surface antigen is positive, that means this is an acute infection. And if you do hepatitis B and you find hepatitis B core antigen, not antigen, hepatitis B core antibodies, IgM, this means that this is an acute infection. Also, you can find, if you find this, you can do PCR for confirmation. Is it this patient is positive, he has hepatitis B or no? Sometimes they use just for epidemiological study, you can use this PCR. So if you see these tables, this hepatitis B surface antigen and anti-hepatitis B core and anti-hepatitis B surface antigen. This is, if you find hepatitis B surface antigen is negative and anti-hepatitis B core is negative and anti-hepatitis B surface negative. So this is susceptible, and this is another patient, and this patient he has no hepatitis. He has no hepatitis B infection. If you find all this is negative, it's okay, but he is susceptible, can be infected. But now he has no hepatitis B. If you find hepatitis B surface antigen is negative and anti-hepatitis B core is positive and anti-hepatitis B surface antigen, not antigen, antibody, anti-hepatitis B surface is positive. That means this immune due to natural infection. Due to natural infection. يعني معناها إن البيشنت ده كان هو infectious, كان infected before this hepatitis B, and he developed anti-core and anti-hepatitis B surface antigen now in recovery. So this patient now immune, يعني now he has immunity, against this hepatitis. Either إنه هو في الغالب إنه كان هو مصاب before and now no chronicity because hepatitis B surface antigen is negative. لكن لو كان hepatitis B surface antigen is positive, this is acute infection or it might be chronic infection. Is this clear? In hepatitis B surface antigen, and if this is negative, an anti-hepatitis B core is negative, and anti-hepatitis B surface antigen is positive. Only one is positive. Anti-hepatitis B surface antigen is anti-hepatitis B surface is positive. What does it mean? This means that there is immune due to hepatitis B vaccine. And if the one or any patient or anyone be vaccinated by hepatitis B vaccine. So if he do investigation or do screening by ELISA to detect hepatitis B surface antigen or anti-hepatitis B core or anti-hepatitis B surface antigen, and he finds the anti-hepatitis B surface is positive, that means this patient is immune due to vaccine, not due to infection. Due to infection, if you find antibody core and antibody surface, both of them are positive. That means this is infected before. He has infection. Now he is okay, recovered. So this is natural infection. But if you find only hepatitis B surface antigen is positive, antibody is positive, this is mean that the patient immune due to hepatitis B vaccine. If you find hepatitis B surface antigen is positive, this hepatitis B surface antigen is positive, and anti-hepatitis B core is positive, and anti-hepatitis B core IgM is positive, and only anti-hepatitis B surface antigen, anti-hepatitis B surface is negative. Yani, so the antibody is negative, but the antigen is positive, and anti-core is positive, and anti-IgM anti-core is positive. All this positive, that means this is acutely infected. Acutely infected. The second one here in this table, hepatitis B surface antigen positive, and anti-core is positive, and IgM is negative, and anti-hepatitis B surface is negative. That means chronic infection. That means chronic infection. Why chronic infection? Hepatitis B surface antigen, it can be positive in acute and in chronic infection. Hepatitis B surface antigen. When you find hepatitis B surface antigen positive, that means either acute or in chronic infection. If you find anti-hepatitis B core, that means acute, or most probably it might be acute or chronic. But if you find IgM anti-hepatitis B core, IgM, that means this is an acute infection. This is an acute infection. If you find anti-hepatitis B surface is positive, this is mean recovery. And anti-hepatitis B surface, but now is negative. Anti-hepatitis B is negative. That means chronically infected. The third example, hepatitis B surface antigen negative. If you find anti-hepatitis B core is positive, and anti-hepatitis B surface is negative, so the possibility is resolved infection. Might be resolved infection. Was infected before and now خلاص recover. Or it might be false positive anticore. يعني this is not a real anticore. جات بالخطأ إنه positive، مفترض ما تكون positive الانتيكور. It might be this is false positive anticore. Or it might be low level chronic infection. يعني هو chronic but low level، يعني chronicity يعني cannot be detected for all this, so it can be low level chronic infection or resolving acute infection. يعني acute infection now start to resolve. خلاص, resolving acute infection if this is all is negative except anti-hepatitis B core is positive. Is it clear? So, in brief, the most important marker, hepatitis B marker, is hepatitis B surface antigen. And if I don't have any marker in my hospital or in my lab, only I have hepatitis B surface antigen, I think this is a good marker to do screening for a patient. It's a good marker for screening. Because this hepatitis B surface antigen is a protein on the surface of hepatitis B virus. It can be detected in high levels in serum during acute or chronic hepatitis B virus infection. The presence of hepatitis B surface antigen indicates that the person is infectious. The person is infectious and he has hepatitis B virus. The body normally produces antibodies against hepatitis B surface antigen as a part of the normal immune response to infection. Hepatitis B surface antigen is the antigen used to make hepatitis B vaccine. Hepatitis B surface antigen is the antigen used to make hepatitis B vaccine. Why? Because we said before, in hepatitis B, there is some part they don't find DNA. There is some surface antigen in the virus. They don't find antigen to combine with him or to take it to be a complete virus. There is, because inside this virus, you find the virus inside the cell, inside the liver cell. They sit inside the cell and ask the cell to produce component for the virus to be for replication. They ask this virus, the cell, to produce component. They ask them to produce more components. So there is more hepatitis B surface antigen is produced. But few of this hepatitis B surface antigen will find DNA to combine with it. So the other, they will be without DNA and it will not find anything to combine with it. So it will be 3 hepatitis B surface antigen and it can be released through the blood, through the serum. So you can find hepatitis B surface antigen without DNA. And this it can be positive for some patient. Hepatitis B surface antigen, you can find it some times. This is without DNA. It can be available without DNA. And before, they use this hepatitis B surface antigen without DNA or without the other part of the virus to be as a vaccine. They take this, they will find the patient of hepatitis B and they take a serum from him, this hepatitis B surface antigen from him to produce a vaccine for others. Before, but now there is vaccine, so they don't need to use this way for producing vaccine. So hepatitis B surface antibody, known as anti-hepatitis B surface, the presence of anti-hepatitis B surface is generally interpreted as indicating recovery and immunity from hepatitis B virus infection. This is clear. And hepatitis B surface antibody, if you find hepatitis B surface antibody, that means what? That means recovery and immunity from hepatitis B virus infection. And who he has a virus before, he infected before, now he is recovered from this infection and he developed hepatitis B surface antibody. This is a good sign for recovery. If you find anti-hepatitis B surface antibodies. For this way, and this most important antibody, some patient, if you do screening for a patient by ELISA and you detect this hepatitis B surface antigen is positive. If you find hepatitis B surface antigen is positive, this is acute infection. Alas, finish. If you find this hepatitis B surface antigen is negative, but the core antibody is positive. The core antibody is positive. So you should do anti-hepatitis B surface screening. Why? To detect. If you find this anti-hepatitis B surface is reactive or it is with a large amount, that means the patient is immune and no need to receive vaccine. This is for vaccination. I think all the students or all the employees in hospital or doctors or laboratory technicians, they should receive hepatitis B surface antigen because it is very dangerous hepatitis, very dangerous infection. And also it is because the infectivity is very high and very easy through this transmission, as we mentioned before, through the blood, body fluid. So you should receive vaccine. For all students, I advise you to take vaccine against this hepatitis B. But before that, all bodies they should do this anti-hepatitis B surface. Anti-hepatitis B surface. Why? To detect if you are immune or not immune. If it is negative, that means you don't have immunity. So you need to take a vaccine. If it is positive or reactive or with a large number, for example, more than 1,000, more than 2,000, you find it in the blood or like that. So you are immunized and you don't need to take a vaccine. This is very important one for the immunity. So anti-hepatitis B surface also develops in a person who has been successfully vaccinated against hepatitis B. So either due to vaccine or due to infection, recovery from infection. Total hepatitis B core antibodies, and this is anti-hepatitis B core, appears at the onset of symptoms in acute hepatitis B and persists for life. And anti-hepatitis B core, you can find it for life. You can detect it for life. So the total hepatitis B core antibodies, the total hepatitis B core antibodies appears at the onset of symptom in acute hepatitis. The presence of this core indicates previous or ongoing infection with hepatitis B virus is an undefined time in an undefined time frame. يعني ممكن يكون حصل له بس في زمن ما معروف. يعني the appearance of this anti-hepatitis core indicates previous or ongoing. ممكن يكون infection before, يعني infected maybe previous or ongoing infection. Still he has infection. Still he has hepatitis B infection with hepatitis B virus in an undefined time frame. IgM antibody to hepatitis B core antigen. This is IgM anti-hepatitis B core. Positivity indicates recent infection with hepatitis B virus. Recent infection يعني less than 6 months. لأنه بعد 6 months will not be detectable. Its presence indicates acute infection. يعني whenever you find IgM anti-hepatitis B core, that means this is an acute infection. As you know, because hepatitis B, the virus and most viruses, they don't have any treatment. So no treatment is given for acute hepatitis B. For chronic hepatitis B, reverse transcriptase inhibitor such as tenofovir or entecavir also can be given, can reduce the inflammation associated with chronic hepatitis B, but does not cure the carrier state. A combination of tenofovir and methotrexate is also effective, and you can give either one or you can give a combination. The prevention involves the use of either the vaccine of hyperimmunoglobulin or both. And you can give hyperimmunoglobulin and you can give a vaccine. As you know, hyperimmunoglobulin, this is vaccine, and this is passive immunity and active immunity. So the vaccine, there is Recombivac's. This contains hepatitis B surface antigen, as we said before, produced by recombinant DNA techniques. They do recombinant DNA technique, or they activating this virus. They're using the hepatitis B. And all healthcare providers and students should receive hepatitis B vaccine. And all they should receive vaccine. If there is one they don't receive this, you should receive this vaccine because it is very important. Vaccination is 3-dose series. Should be followed by assessment of hepatitis B surface antibody, as we said before, to determine vaccination immunogenicity, and if necessary, revaccination. Yani you can receive 3 doses, one at 0 day, the second one after 1 month, and the third one after 6 months. 3 doses you can receive it. This is the vaccine. And this is Recombivax. Recombivax is recombinant DNA vaccine. So you can do hepatitis B surface antibody before. If you don't vaccine, maybe some people they can expose to hepatitis B before. Some people they immunize and they don't know. So if on some of them they can receive vaccine more than 10 years, and if you receive vaccine before, or some now receive vaccine during childhood vaccination, so you should check again this hepatitis B surface antibody. If you find hepatitis B surface antibody is negative or low, you should take a vaccine, or you should receive or you can do revaccination if you receive vaccine before. Healthcare providers who do not have protective concentration of anti-hepatitis B surface more than 10 ml international dermal, so this you should revaccination. You should revaccination. As after receiving a total of 6 doses, should be tested for hepatitis B surface antigen and anti-hepatitis B core to determine their infection status. Hepatitis B immunoglobulin, this contains a high titer of hepatitis B surface antibody. It is used to provide immediate passive protection to individuals known to be exposed to hepatitis B surface antigen positive blood after an accidental needle stick injury. يعني لو في واحد حصل له إبرة انضرب بإبرة أو بحقنة خلاص، والحقنة كانت أصلا لمريض مصاب بهيباتيتس بي، ومعروف إنه هو case of hepatitis non case of hepatitis B، أو الإبرة دي ينطعن بها، معناها على طول مفترض إن البيشن ياخذ، مش البيشن المصاب بالإبرة أو بالحقنة مفترض ياخذ immunoglobulin خلاص، لأنه الاميونوجلوبولين بيديك باسف immediate passive protection اللي هي passive immunity، يعني بتاخدها immediately after the injury. The needle stick injury from a patient with hepatitis B surface antigen positive blood is that both the vaccine and immunoglobulin and vaccine and hepatitis B immunoglobulin should be given at separate sites. يعني ممكن ياخذوا من الاثنين، ياخذ الحقنه اللي هو حقه التطعيم حقه الهيباتيتس، وياخذ الهايبو اللي هي هيباتيتس الاميونوجلوبولين، هايبر اميونوجلوبولين، ياخذ الاميونوجلوبولين لكن بتتاخذ في اي واحده في سايت، يعني واحده تتاخذ على اليد دي وواحده في اليد الثانيه، بتكون at separate site. Both vaccine and hepatitis B immunoglobulin should also be given to a newborn whose mother is hepatitis B surface antigen positive. يعني لو كانت في واحدة عندها hepatitis B surface antigen وعندها طفلها طلع عنده hepatitis، أو طفلها ما معروف إنه عنده أو ما عنده، لكن اتولد من مضر عندها hepatitis B، ففي الغالب إنه ممكن يكون أخذ infection، خاصة إذا كانت during normal delivery اللي هي جاي pass through the base canal. It can be infected during the base canal because as we said the body fluid contain high load of virus. There is high load of the virus in the body fluid. So they should give him a vaccine plus hepatitis B immunoglobulin to protect this newborn. Some study, mainly in this in OPS and GYNA, they advise mother, or always they can prevent this newborn or the baby by cesarean section. And if they know a mother of hepatitis B surface antigen, if they know the mother has hepatitis B, and the baby can be delivered by cesarean through the cesarean section, not through vaginal, because through the vaginal delivery increase the risk of the infectivity of the newborn. Hepatitis B virus and Delta virus, and this hepatitis B virus can cause hepatitis Delta, and this is Delta means this hepatitis B, or sometimes they say this defective virus. It is a defective or Delta virus. So this B from Delta virus. And this hepatitis B virus is unusual in that it is defective virus. What does it mean, defective virus? It cannot replicate by itself because it does not have the genes for its envelope protein. يعني هي ما عندها الكomponents ولا ما عندها الانفلوب proteins or genes عشان to be the virus, to develop itself as the virus. So this defective virus يعني cannot replicate by itself. It needs another virus to combine with him and to take some components from that virus. يعني alone it will not be a virus. It will not do or make a disease. It will not make a replication for itself. So hepatitis B is a defective virus. And hepatitis B virus can replicate only in cells also infected with hepatitis B virus, because hepatitis B virus uses the surface antigen of hepatitis virus. With hepatitis B virus, because hepatitis B virus uses the surface antigen of hepatitis, because it has no surface antigen, so it uses the surface antigen of hepatitis B virus. So if there is patient infected with hepatitis B, it can also be infected with hepatitis D. Not mandatory, but it can. But hepatitis B alone, it is not cause infection because it is not a virus, or because it does not have the gene for its envelope proteins. Hepatitis B surface antigen, as it is envelope protein, hepatitis B virus is therefore the helper virus for hepatitis C. So we can say hepatitis B is a helper virus for hepatitis D. يعني هو الفيروس المساعد لهepatitis D. يعني hepatitis D ما يقدر يعمل حاجة alone. He needs another virus, and always he uses the hepatitis B surface antigen of hepatitis B virus. So the hepatitis B virus is an enveloped virus with an RNA genome. And this enveloped virus, RNA genome, that is a single-stranded RNA, plus covalently close circle. The RNA genome of hepatitis B virus is very small and encodes only one protein. The internal core protein called delta antigen. خلاص اسمه delta antigen. Hepatitis B virus has no viral polymerase. The genome RNA is replicated and transcribed by the host cell RNA polymerase. يعني من الhost cell polymerase he can transcript by this polymerase. Hepatitis B virus has one serotype because hepatitis B surface antigen has only one serotype. يعني زي الهيباتيتس بي only one serotype، نفسه الهيباتيتس دي اصلا معتمد على الهيباتيتس دي على الهيباتيتس بي، ولانه هو المساعد له عشان كده هيكون هو has only one serotype. He has only one serotype. Here if you see this here, hepatitis B and hepatitis D in one cell here. Hepatitis double-stranded DNA, this is in the left side. This is hepatitis B virus. This is core, polymerase, and DNA surface antigen of hepatitis B. In the right side, you can find the hepatitis B virus, and this is single-stranded circular RNA, single-stranded RNA, small delta antigen, large delta antigen, and farnesyl here. This is the structure of hepatitis B virus. When we see the transmission of hepatitis B virus, so hepatitis B, the virus is transmitted by the same means as this hepatitis B virus. لأنه هو is a helper and دائما بيكون هو with hepatitis B virus، عشان كده هو هيكون محاكي له في أي حاجة وهيكون similar to hepatitis B. The same mode of transmission of hepatitis B through sexually, through the blood, prenatally, like that. Hepatitis B, we can take this B, find 2Ds, defective virus, 3Ds, delta virus, defective virus, and depends on hepatitis B virus. This D means hepatitis B means defective virus and depends on hepatitis B virus and hepatitis B surface antigen code for entry into hepatocytes. So it helps hepatitis B, it helps hepatitis T to its replication. Clinical finding can occur only in person infected with hepatitis. So because it is alone, it is useless, or it is unable to do infection alone. It needs helper. This helper is hepatitis B virus, so can occur only in a person infected with hepatitis B virus. A person can either be infected with both hepatitis B virus and hepatitis B virus at the same time, and this means as co-infection. Co-infected يعني يكون عنده two virus, two hepatitis at the same time, or be previously infected, or إنه يكون هو infected before by hepatitis B virus and now super infected بعد ما خلاص يعني هو أول كان عنده hepatitis B virus ما قبل الاثنين في نفس الوقت, and then super infected by hepatitis B virus. So hepatitis is a patient co-infected with hepatitis B virus, and hepatitis B virus is more severe than in those infected with hepatitis. يعني لما يكون هو infected by hepatitis B virus alone بيكون أخف وطئا من إنه يكون infected by hepatitis B virus and hepatitis D virus at the same time. So this is co-infected or super infected. For laboratory diagnosis, co-infection, anti-hepatitis B virus antibodies and anti-hepatitis B core IgM antibodies are positive. If super infection, you can find anti-hepatitis B virus antibodies are positive and anti-hepatitis B core IgM are negative. And if it is co-infection, I mean the infection occur at the same time, you will find hepatitis D antibodies and hepatitis B core IgM positive. If super infection, I mean the infection occur after hepatitis B, already the patient infected before by hepatitis B, you will find only anti-hepatitis B virus antibody are positive, and you will find an anti-hepatitis B core IgM antibodies are negative. For treatment and prevention, there is no specific antiviral therapy, no specific antiviral therapy against hepatitis B virus. There is no vaccine against hepatitis B virus. Yani we have a vaccine against hepatitis B. If you protect yourself against hepatitis B, so you will protect yourself against hepatitis B, because hepatitis B, it needs hepatitis B infection to be infected. So there is no vaccine against hepatitis B virus, but a person immunized against hepatitis B will not be infected by hepatitis B, because hepatitis B cannot replicate unless hepatitis B virus infection also occurs. So by indirect way, you can protect yourself against the hepatitis B by if you receive a vaccine against hepatitis B virus.